Welcome back to another show with Dr. Sudhakar Rao here, a very eminent cardiologist on our Open Minds, Safe Spaces, brought to you by Inspiron Psychological Well-Being Centre. Today, we're going to be dwelling deep a little more into cardiac health and mental health. And we will know the details of what we can all do for better heart health. Stay hooked on, and you will learn a lot more. How do you manage stress in your daily life?
Walking at least 30 to 40 minutes per day,
Any other nutrients that will help with heart health?
but it is a sudden event which happens.
Want to supercharge your heart and brain? Omega-3s are the secret. These powerful nutrients lower bad cholesterol, keep your heart strong. Plus, they fight off inflammation like a pro. Here are the foods. For plant-based options, chia seeds, walnuts, flax seeds, algal oil. And if you love seafood, salmon, mackerel, sardines.
Okay, that's interesting. But what do you think, doctor? Is omega-3 actually beneficial?
Actually, last few years, what we are seeing, people with high triglycerides, like 400, 500 and all, who comes to us, they do not have any other causes like thyroid issues, diabetic, or like any other alcohol related. So this has become the routine or the first line of treatment in those people with high triglyceride. And we see a lot of people, they respond well. 500 milligram, one tablet per day for 3 months, and they decrease the triglyceride to a very good levels. Apart from that, we also tell them to take what is there in omega-3, like take polyunsaturated fatty acid, fish oil, cod liver oil. If they take that also, we see a significant improvement in their triglycerides.
Any other nutrients that will help with heart health?
It is what we tell, it's the flax seeds. Most of the people at their house keep the flax seeds, and it helps in decreasing the triglycerides and the LDL levels to a great extent.
Thank you.
When the blood supply that oxygenates the heart muscle is significantly decreased or stopped entirely, a heart attack happens. This occurs as a result of plaque, which is a mass of cholesterol, fat, and other compounds blocking the coronary arteries that provide blood to the heart muscle. This sluggish progression is referred to as atherosclerosis. A blood clot forms on plaque that ruptures in a cardiac artery. This blood clot may obstruct the artery that supplies the heart muscle with blood.
What exactly is a heart attack and how does it occur?
So heart attack is nothing but a sudden stoppage of the flow to the important muscle in artery. As I discussed, many people may live with some 40%, 50% blockage. But it is a sudden event which happens, like we say sudden heart attack. They may be living with this block, but there is some incident, some physical stress, some mental stress, trauma, where suddenly this cholesterol plaque ruptures, and then there is a sudden stoppage to the flow of the artery. So it causes a complete obstruction of the blood flow to that artery, and that is what is called heart attack.
How do you treat a heart attack in a hospital?
So the people who come with heart attack are usually very sick, and they are the group of patients who should receive immediate attention by angioplasty. They come to the hospital in the golden hours. We take them to the cath lab, we remove the clot, and in most of them they need a stent, which is nothing but a metal in which a drug material is embedded, and that helps in keeping the artery open.
What is the procedure of angioplasty and what are the complications that come with it?
So as we discussed, angioplasty is a procedure which is done in people who have critical life-threatening blocks, like any vessel which is more than 80% luminal stenosis in any of the arteries. So the first thing what we have to tell them, it depends on the number of blockages. People who have very advanced blockage go for bypass surgery. People who have one or two or few blockages which can be managed by angioplasty go for angioplasty. Angioplasty is a procedure where we first rupture the cholesterol deposition by a balloon. So that is called first balloon angioplasty. And then we take a stent. Stent is nothing but a metal over which a drug is embedded that keeps the vessel open for years. If you do not put a stent and do only the balloon angioplasty, that artery may recoil again and again. So the previous years people used to do only balloon angioplasty and people used to come back with a symptom because the artery recoils back. Now to keep it patent, you have special technologies like a drug-eluting stents which over years keep the vessel in its normal shape and patent. Now you asking about the complications because you are working inside the artery. Every procedure comes with some complication which may be very minimal, maybe less than 1%. People can have blockages within the stent, more common in diabetic people. People can have perforations during the angioplasty, which is common in extremely calcified arteries. People, when they come with heart attack and we do angioplasty, they may have the complications which may not be related to angioplasties, like the arrhythmias, hypotension, sudden cardiac deaths, all those things which are a part of heart attack itself.
Thank you. We just have a few quick questions here, right? What's the one piece of advice you'd give for a healthy heart?
That will be prevention is better than cure.
How do you manage stress in your daily life?
Walking at least 30 to 40 minutes per day, spend time with family.
What's the most misconception about heart health?
That even if you are having a healthy life, physical activity, you can live forever without a heart attack.
Can you share a quick tip for someone recovering from a heart surgery?
Keep yourself well motivated. Don't go into depression, anxiety, post-traumatic any disorders because you have only one heart and one life. Live it to the full.
What's that one thing that you swear by for mental and physical health as a daily habit for yourself?
I always feel that if you want to rephrase this question, can you just...
What is that daily habit that you can engage in or you engage in for better mental and physical health?
So I, again, as I told you, it will be I go for a walk alone 40 minutes and just think how I have to spend that day.
That's wonderful. Can you tell us a myth about cardiology that you wish more people would stop believing?
It's a very easy life. It's all about money because it comes with all stress. Maybe the same money.
Your go-to healthy snack, what is that?
It's the first nap which I take. It's like I take a lemon water only with some mint salt in it every day.
In the morning?
Yes.
Empty
Empty stomach. Yes.
Okay. Thank you so much. It has been lovely having you here
Thank you.
and a lot of insights. And I'm sure there are going to be people who have more questions. And when they reach out, we'll reach out to you for the next segment. But thank you for all of your inputs. It's been lovely having a conversation with you today.
Thank you. My pleasure.
Thank you.